Okay. Is everybody okay with those additions? Anybody against those additions? If I could just get a motion and a second for that.
I make a motion to approve the addition.
All right, we have a motion from Heather,
I'll second.
second from Anna. All in favor? Aye. Any opposed? Motion carries. We'll get to those in that order that they're already in. Next is we have the April 3rd, 2025 meeting minutes. Are there any changes, deletions, additions, anything related to those minutes? If it's possible, Melissa, if we can fix Layla's name to match her real name,
Yes.
is in the public comments under 3.1.2. I don't have my glasses, but I think it's Leila.
Yes, that's correct.
Thank you, Layla. All right, if there's nothing else, if I can get a motion and a second to approve the meeting minutes.
I'll make a motion with that correction as stated.
All right, we have a motion from Brad as amended
I'll second.
and a second from Rachel. All in favor? Aye. Any opposed? Motion carries. 2.5, conflict of interest. If we're talking about your agency and your agency receiving a contract or any kind of funding, please leave the room. Moving on. Number 3, public comments. Any public comment related to the continuum of care in our jurisdiction, but not on the agenda. Anyone wish to make a comment?
I do.
Please.
One, as I'm having an open house for supporting Bright Futures at my men's home, because I've had quite a few community organizations asked to come out and visit, and I'd love to have everybody come out. So I planned May 15th at 1 o'clock. And if I can get approval, I will send an invite through this committee. I can give it to Melissa, if that's okay. And also, along with that, if everyone can bring their brochures, because we have a brochure holder for resources for the people living in the house, so that they can have access. I stock them up with, how to apply for Medi-Cal and food banks and things, but any resources you have would be great if you wanted to bring them. And then I have one more thing, if that's okay. We had spoke before about scheduling a work group for focus area 3. And I wanted to see if we can get that scheduled and get that going. And it was for find solutions for assisting the chronically homeless and those who are hard to house. And in a couple meetings back, Bruno, you asked if it could be scheduled. I think you wanted it after the strategic planning committee meeting. So I wanted to see if we can get participants and if we can get that on the schedule to get that going.
So I'm hitting a block of amnesia here, and I apologize for that. Melissa, do you have any updates on that? Did we miss adding that into the strategic plan? If that was supposed to be the case, is that something that we could just make sure is on the agenda for the next strategic plan meeting?
I believe that there has been discussion about having a meeting that Angelique Cole was going to be facilitating, and it was going to be happening. The discussion was having that take place after the strategic planning committee meeting. I believe it was also related to the strategic plan, which is why we had talked about having it after the meeting. In my mind, for some reason, I'm thinking about zoning regulations.
Correct.
And so that's what this is, right?
Yes, it's the zoning
Okay.
regulations. There's 3 steps, action steps, and it's all regarding zoning regulations and putting together a committee and inviting code enforcement, or we talked about Lisa from planning department and other members who wanted to participate in this group. And I brought it to the strategic committee a little while ago, maybe a couple meetings back. We talked about it and got approval to go ahead with the committee.
Okay, Angelique and Melissa, let's work on that outside of this meeting today. I think let's move forward. Let's figure out who we need to invite and so on and so forth. As far as the first request, absolutely, please send any information to Melissa and she will pass it out to the entire membership.
Great, thank you.
That's okay with you, Melissa?
Of course.
Okay, thank you for your comment. Any other public comments? All right. Moving on to action items, voting membership changes, 4.1.1, Department of Social Services, second voting member change, Teresa Schoen. Teresa, if you can do a brief introduction, or did you already do that last time? I think, no, you didn't do that last time.
No, I don't. Don't think I was in this meeting last time. But I'm Teresa Schoen. I've lived in this county my entire life. I've been a program manager here at Social Services for 16 years now. Recently moved to the housing division. So now instead of being over welfare to work and employment services, I'm now learning everything I can about housing programs here. And so that includes the Section 8 program. And then we have housing programs that are separate, which are CalWorks programs, Housing Support Program, Housing Disability and Advocacy Program, and TAY, which is Transitional Age Youth.
Perfect. Thank you very much. Any comments or questions?
She would be my alternate if I was not able to attend the meetings, much like Lisa was.
Okay. As it says, second voting member change. Any other comments or questions? All right, looking for a vote.
Oh, we have to make a motion or no? No vote. We don't need to, right?
I thought we needed to vote.
Just vote on them.
Melissa, tell me what to do.
Do you need me to step out?
We need a motion. No, we need a motion and a second, and then we vote.
That's what I thought.
Since I told her to join.
So we have a motion from Rachel and
I'll
a
second.
second from Doreen. All in favor? Aye. Any opposed? Motion carries. Thank you. Do we have Eva Lara?
Yes.
Holy smokes, I'm so sorry. So we have from the probation department, Eva, would you like to introduce yourself?
Yes, I am Eva Lara, and I will be sadly replacing Meredith Lawyer, who decides to leave us next month.
We're not happy with her.
Yeah, we're not. I'm not, and she likes to throw it out over there. So, sadly, she moved her retirement date to the beginning of next month. So I have less time with her, less time to learn. I know I'm happy to be here and see what I can do and help and learn.
Thank you very much. And by the way, she's not just leaving, she's literally getting out of the country as well. That's not just.
She bought a house out of state, and then something about going to Australia.
Yes.
Go find those giant spiders.
Fun times, giant spiders. All right, thank you very much, Eva. Any questions or comments? All right, looking for action.
I move to accept Eva Nara as replacement to Meredith.
All right, we have a motion from Anna and a second from Chief Stovey. And all in favor? Aye. Any opposed? Motion carries. 4.2 action items from April 2025 monthly meeting. Melissa, to add missing members to the roll call. I feel like that's.
Can we jump back just a moment because we added the nominations for performance review?
That's why, thank you so much for being here and helping me out. We're going to go back to 4.1.3, which we added in the agenda review, nomination and performance review chair. We had a resignation from the previous chair for very good reasons, just overwhelmed with a lot of other activities and need to better focus on those activities. But still continuing to be a part of the performance review committee when the chance is available. Right now, we are looking for nominations, but just to at least let you know, I am willing to take it on at this moment in time with the assistance of Heather to at least carry it on until somebody else raises their hand. So today, if somebody wants to raise their hand, we would love to nominate you, but if you don't, we will continue to pester you until somebody raises their hand. Seeing none, then I guess I will make a request for a nomination for, I guess, chair and vice chair. I don't know how you want to word that out, or if you want to just say co-chairs. But for myself and Heather Frawley to be the chair.
I'll say what you said.
Okay.
Yes, I will nominate Bruno to be the chair and Heather Frawley as the vice chair or co-chairs.
I'll second.
All right. We have a motion from Rachel and a second from Brad. All in favor?
Aye.
Aye. And any opposed? Motion carries. Thank you for bringing us back to that, Melissa. Melissa, 4.2 items. I'll let you take those.
It'd be, so 4.2.1 and 4.2.2 were action items from the previous month. One was for me to add the missing members to the roll call, which I did complete, and also add the Housing Navigator and RCS Home meeting to the May agenda. I reached out to the person who was supposed to be doing the presentation for RCS Home. I never received a response back. And at the end of this meeting, further down after the committee meetings, there has been an addition to the agenda for all working groups to be able to give updates. So those are both complete.
Thank you very much. Justin, are you able to reach out to RCS Home and see if we can get them on a future agenda?
Yep.
All right, thank you. We have no presentations today, so committee updates, and we will start with Heather.
Well, we are working on the new unaccompanied youth and transitional age youth. So it's 25 and under. We're working on the vulnerability assessment. We've actually made really, really good progress. And then I think we're going to do families next. We're going to do a vulnerability assessment for families. So yeah, so things are really moving along very quickly. I'm pleased.
How's the data entry going? Are we getting good data from folks? Are we having to harass people for data? Is it clean data?
We are having to harass folks for data. So I pulled so we have 293 people on the by names list. And we have a little bit of a disconnect because we have more people entered in the projects than we have vulnerability assessments for. So I have to go and kind of reconcile that and figure that out.
Are we reaching out to those that are not entering data appropriately or timely?
Yeah, I sent each organization a list. These are the people that are active in the hub. What's their disposition? Are they housed? Did they, what happened with this person? So,
Do they have a time frame of when they're supposed to get that accomplished by?
I asked for it by last Friday, but some people got it late. And so I have a task to follow up this week and send an email to everybody.
If you want to CC me, you can. You don't have to. But
Okay.
If I can be helpful in getting them to move, pulling them in, that would be easily done.
Heather, I have a question. So for next step, she got the new vulnerability assessment done. You have a huge finding list. When are we going to start doing case conferencing, which is kind of a HUD requirement as well?
So we have been doing it. A big part of what some of the issues are is getting organizations to document in the hub, and then reporting out on that and seeing who needs help. So
do you have like a set time and agency invites, or how are you managing all the case conferencing?
So I picked the top 10 on the my names list.
Mm-hmm.
And we've gone through some of those. And I think actually a few of those people have been housed as I'm kind of going through and researching.
And so if you have a name and you're deciding, okay, we're going to go through do you invite the people that have been working case managing into kind of case conferencing, or how are you?
So if there's still, so what I'm doing is I'm running their partnership to see if there's an active TAR. And if there isn't an active TAR, then that means generally no one's really working with them. So there's kind of still a disconnect between, you know, the hub and people documenting in the hub and then being able to translate that information into coordinated entry and the other projects.
If I may say, I could personally say that working in a nonprofit organization, I do love the emails and the contact that I get from you, Heather. I love the hub training, reminders and invites. I know we're working towards getting all digital and you always set up enough time. So just say that that's really nice.
Thank you.
So we had a conversation about case conferencing. Do you do it during your HMIS CES? Do you do it separate? What's the?
So it's been slated.
And then also, and how's that interact with the Housing Navigators Committee?
So it's at the end of the Housing Navigator Committee meeting.
And so what we had discussed and heard, and please correct us, is that because it's at the end, sometimes it gets kind of squeezed.
Yeah, it does.
And we're wondering, since you do 2 housing navigation meetings a month, can one be housing navigation and one be specifically case conferencing only, so that it really focuses on the people that are on the list and figuring out with the partners in the meeting on how can we help this individual who is nobody started a project, they've been bounced around, or whatever the case might be. Would that be an appropriate change? Because we're looking to enhance that interaction of case conferencing.
Yeah, I definitely agree with that. Is Caitlin Murray on or Christina?
Christina's here. I don't see.
Yeah.
Okay,
I'm on. I think that's a really great suggestion, Bruno. I think we would need to just bring it back to the group and ask them if they're explain the situation, tell them the challenge, and see if they'll agree to that change. But I think it's doable, and I like it. So we'll do that at the next meeting. We'll put it on the agenda to discuss and see if we can adopt that schedule where, you know, maybe the first meeting of the month is case conferencing and the second is general, or vice versa.
Right.
Thank you.
Okay. I would love to know how that works out for you. What I'd also love to know is who's missing from that conversation, because it's important to have all the partners that can offer services to getting people housed or to the right services. And that's difficult because there's a lot of partners here at the COC. But I really want to highlight something that Heather said, and I know that it's a pain in the butt. And I really had to think to not use the wrong word. Data is a pain in the butt, but data is super important for what we're trying to accomplish. It helps us be funded, and it also helps to track the individuals that we're serving. If we're not entering and inputting data, which to some of you, I get it, it's a pain. You're already entering it in your own agency software, and then sometimes you have to duplicate and enter it in our software that we're asking everyone to use. And I hope that we can find ways to bridge that. I know Melissa was working on some bridge between, I think it was HMIS and CES or something of the kind, but that doesn't necessarily mean it's gonna bridge it between all of the softwares that are available where you're tracking patients and clients. But at least if you have a contract with us, it doesn't mean you have a contract with us. We are paying you to do the work of HMIS data entry. And so that should be a part of your quote or your proposal when you submit that to us. Is part of the cost of the service should be to enter that data. So if we're not getting that data and you have a contract, I'm a little frustrated. We need to figure out how to get everybody on the right page. If you don't have a contract with us, I kind of have to plead with you to please enter the data because I don't have a leverage whatsoever to pull. But if we want to take care of people, it's not just doing it out of the kindness of our heart. It has to be a part of a structured system that will actually follow up with the needs of every individual, because one of you will not be able to be successful with one client. It's going to be all of us that will make it successful for that client. And so the data is really important. It continues to be a bit of a negative when it comes to HMIS and data entry and CES, and just really trying to push. We have to enter the data. It's great that we take care of people, but we're not going to be able to follow through with everything they need if we're not able to pass on that information to the next step. We have no warm handoff if we don't have the data entered in the system. So please, I have some hands up. I see Angelique, I believe, is number one.
I just wanted to know what the requirement was if I'm supposed to be doing this. I don't know what the system is. I hear about it at meetings, but I don't know what data we're getting, and if I'm supposed to be, as a housing person, supposed to be entering anything.
So I would suggest that sorry, Melissa, I keep doing this to you. I would suggest you have a conversation with Melissa on how best to interact with our systems. I don't know what systems you use. I know we don't have a contract with you, but I appreciate the question, because yes, we have to find ways to connect in some way, shape, or form. So I would say have a conversation with Melissa outside of this meeting, and let's see how we can make sure that your information is connected to our information. And I would suggest that if anyone else in this meeting is in a similar situation, we need to maybe broaden that scope of that conversation, and not just a one-on-one, but invite everybody who happens to be in that same position, so that we're not asking Melissa to have 10 different one-on-ones.
He does have office hours.
And sometimes I go in and there's nobody there but me and her. Heather has her hand up.
Yeah. Starting to look at, so I've been creating reports in HMIS and the Webby app, and it's business analytics software. And I'm going to start kind of looking at, I created a report where it's the projects, when they went in and when they exited, and kind of start looking at how long we have people sitting in projects unhoused. And then people that are exited to housing and then are coming back. So I'm kind of trying to parse the data a little more and just where we're at. So we know what areas to kind of focus our attention on.
And I guess what I would liken it to is we are providing some sort of care similar to healthcare. In healthcare, you have a chart for the patient and you have a story that goes along with it. How did you get this patient admitted? What kind of care did you get? Were they ordered and signed by a doctor? What was the requirements? Did you meet those requirements? And then did you close and discharge this patient? All of those things need to be in a chart for a patient. All of those things need to be HMIS. We cannot drop people to think that they're still, we can't have 100 people in one shelter that only has 35 beds because we did not actually discharge them electronically as well. So all of those things need to be followed up on. It's a pain, it's bureaucratic, but it helps all of us better understand if we can pick up the pieces of what's the next step, rather than thinking that they're continuously still in the same place. Ronnie?
Yeah, I was thinking, like my role, right, is kind of disconnected where I'm writing the grants and I'm in charge of the operations and making sure our budgets are good and our programs keep running, where the people on my team that have the HMIS licenses below me are doing direct service. And sometimes it's incumbent upon our leadership to communicate how important this data is for future operations, and that we have a contractual obligation with the county to enter this data when we get a grant so that our programs can keep running. And I had something else, but I'm experiencing some brain fog today. So I think just maybe having a group with the people who have the licenses to enter the data and really explaining how important this data is for us. And not only that, if we want to address homelessness, this data is very important.
Absolutely. And I will say, I know Heather does trainings all the time. So I think it's conveyed the importance of it, but I don't think we're ever going to stop conveying the importance of the data. And I will say, if you are a hospital or healthcare facility, you get audited by Medi-Cal and Medicare. And if your charts do not have the appropriate paperwork in there, or missing any type of actions you should have taken, such as discharging paperwork or things like that, then you get requested for money back. I'm not saying that's what we need to do, but maybe we need to do some random audit checks from time to time and call those out when what our findings are.
That's what I remembered. Sorry, Bruno. It was that point. Maybe incorporating some HMIS reviews in the performance review committee would be helpful.
Yeah,
Just a thought.
the committee, yeah, I can start including that.
We already do. So it's already requested from an agency that we're reviewing to have 5 at random intake packets and HMIS data as a part of that review process.
And we've taken, I completely forgot, I'm having the brain fog. We also implemented a new policy that if you are not providing the data appropriately and we're in the middle of a contract review where that contract is still continuing, that we have the ability to put a contractor on a performance improvement plan, and that you have a limited time to get up to speed and do what you promised you would do within the contract. We haven't had to do that yet. And we have not taken it to the next step where we are canceling contracts because you're not fulfilling your end. But those are all potential options that we would prefer not to take, but at the same time, we have to hold people liable. Okay. Anything further on HMIS? Thank you very much, Heather. Interfaith is Jay Murdoch. He is not here today. And I don't think that Deborah's here either. So we'll just go ahead and move on. Melissa, did you have anything on that?
No, I don't.
Performance review. It is no longer Carissa. That would be me. We have 2 more older contracts that we need to do performance review on. We seem to be struggling to getting data from those 2 contractors. It is fairly old. I believe one of them responded pretty quick to you, Melissa, Worldwide Healing Hands, if I remember correctly.
Yes,
so
that
should be good. And then the next one is NCO, and I tried contacting them and I wasn't able to connect. I'll connect again. I know that they were out of town at that time. So we have those 2 contracts, and then we have one upcoming for the current RCS Homerton Haven contract. This would be the full 1.5 years. Sounds about right. Yep. So it's been about 1.5 years since they've been providing those services, and that's it. That is an ongoing contract, and we will be doing that in late May. I forget the exact date, but that's the status of the performance review.
We also need 2 months so that it's easier for people to remember. Yeah, we set our performance review in the committee to May and November. So every May and November, that's when it's going to happen, so that people that do have contracts kind of understand those are the months they'll have to come in and talk to us about their programs.
Yes, thank you for adding that. Anything else? I see a hand from Carissa. Carissa and crew.
Yeah, I was still on HMIS. Is that okay?
Let's go back.
I know that we speak in general terms a lot about non-compliance for HMIS, and I can confidently say that Hope Center and Adventist Health is not included in that. We document because as Ronnie's point, we know how important HMIS is. I think a great idea that someone had, I think it was maybe in a performance review committee, was creating a transparency where things are on the COC website I know we don't want to be unkind and call people out in general big public meetings, but I also think if we create a transparency, that could be helpful too. Because it's not every agency that's not documenting an HMIS. It's, it's some agencies that are affecting the whole. So I was wondering if there was any more progress on what's going to be on the COC website as far as creating more transparency goes.
And I appreciate the question because I'm absolutely in support of that. And I think we'll get to that in the administrative entity reports.
Okay, awesome. That was it.
No, thank you. I agree that we can be more transparent, leading to greater outcomes. If there's nothing more for performance review, we're going to move to the point in time count. That's Pastor Shannon. She is also not here. Melissa, did you want to add anything?
I don't have anything to add. I don't believe we met, so we're still kind of in limbo with the PIT and HIC count.
Explain limbo.
Just waiting to meet up, I think, as a committee to discuss the things that Pastor Shannon had brought up and wanted to bring back to the committee. And then also, this will end up being in my report, but also just waiting for the HIC and PIT reporting to open up in HDX for HUD.
Person doing 10 persons job is going to get that accomplished very soon right now. Yeah, HUD might be a little slower than usual.
HUD is being slower than usual.
We're gonna move on to strategic planning. Ms. Santana.
So we had a very productive meeting last month. We basically planned out our, what are we calling it, open house?
Town hall.
Town hall.
For the lack of a better term.
The COC for the town hall for the COC. October what?
September 24th.
24th.
Oh, I was close. Gonna say 7.
I believe there's hopefully gonna be a save the date sent out. We are gonna be hosting it at
Soparis.
And hopefully, Jay's gonna do the moderating of the panel. So.
You can pay TV.
Peg can be there.
Peg
TV, yeah.
So we can stream it.
Yeah, so we really want, we want to use this as an outreach event. So please, when the save the date comes out, please inform any of your immediate circle people so that we can have a good show.
Thank you.
Okay.
Any questions, comments? Seeing and hearing none, moving on to administrative entity reports. Contract of interest policies. Scott.
I'm not exactly sure what that is.
It's got your name next to it.
I know. I think you meant conflict of interest policy, right, Melissa?
I believe this was the discussion that we had, Scott, about the potential contracts that needed to be brought back to the COC, but after going through the meeting minutes, we discovered that it was already discussed at the COC.
Okay.
The one for Adventist Health.
Okay. I guess you could say one thing that I was thinking that was about our conflict of interest policy, making sure that everyone signs it annually. We have, so I'll just go through the list again. Everyone had signed it that was on the grant selection panel. The requirements we had was, I know it was a little small compared to our membership. And so we're going to send out some reminders, I think, for people that haven't signed theirs yet.
Okay. Anything else to add to that?
The only thing I have to add is the conflict of interest policy has already been sent out to all COC members. So if you have received it, please click on the Adobe sign request and fill it out. And if you have not, or you cannot find it, let me know and I will make sure it gets to you.
You can send out a reminder to everybody. Top of their email right there.
Yeah, if it's possible to send out a reminder, that would be great. Okay. Next is system performance measures. Melissa?
That would be me. The system performance measures has been submitted. We experienced a bit of a drop in people being permanently housed in the system performance measures. The final date to have any corrections was yesterday. And based on looking over the data with our consultant, we were able to determine that there was no changes that could be made because the data was correct. So some of the areas where we're hurting right now are just, in my opinion, and based on the data that I'm looking at with the different agencies at the Homaton shelter, having so much turnover with the agencies, we ended up with a lot of data that HUD probably wouldn't be happy with there. And then also changes within a couple permanent housing programs. There's a large number of individuals that usually get housed in one of the programs that did not. And so we ended up dropping numbers as far as permanent housing goes within the system performance measures. And so that's something that I believe, based on the changes that we've taken within the COC, we will start seeing improvements on it. It's just not going to happen this year. You know, the other thing that ended up taking place within the COC that's for the system performance measures reporting that's in the positive, what is behavioral health starting to enter in their data for the people that they have housed. So if we end up with housing providers or providers who are housing individuals, whether it's transitional housing or permanent housing, and we can get that data into HMIS, then that will improve our system performance measures. The more we end up improving our system performance measures, the better our application for the HUD competition will be. And the better our application for the HUD competition is, the more funding we will end up getting. And then that's where we end up going into that tier 2 funding and being able to start increasing that and accumulating more funding through that second portion of the HUD funding process. And then, like I said earlier, the PIT and HIT count are going to be opening soon. I haven't heard about when that's going to be opening, but it will be happening soon. And other than that, the only other thing I have to report is the data changes that are going to be taking effect October 1st, 2025. And the data standards within HUD are changing, and they're going to be taking away all language for gender, and it's going to be specific to sex only. And that's what I have for my report.
That saved a lot of money to change all of our applications to just say a different way of saying gender. I would love to know how close are we to tier 2? Like if you had like a thermometer, are we at like 85% there, 95% there? Are we at 40%?
Scoring, back yet with how we did. We just know we didn't receive it. However, we can speculate with Melissa and I have done, it's because of our system performance report.
Right.
It is
but I just wanted to know, like, how close are we? I mean, we're asking
a lot
people.
Closer to when we were.
And that's good too.
We've made a ton of improvements. Tons of improvements.
I think that the easiest way to really explain it is the HUD competition application is worth 200 points altogether. The system performance measures is 60 of those points. And until we end up with good data, we are missing out on more than half of those 60 points.
And that's partnership. That's not one person's not entering the data. Ronnie.
I think you just answered my question. Is this all gathered from HMIS? Sorry.
Yeah, this is all projects in HMIS. All street outreach projects, permanent housing projects, emergency shelters, transitional housing. And so that's another thing too. We ended up losing our only street outreach project also in the last fiscal year.
Oh, that's why I harp on the data, because it's important for us to have that.
Yeah, and I was hoping to be able to have all that information on a presentation to present to the COC, but after HUD came back with this discussion on trying to figure out if it was accurate, I didn't have enough time to put all of that together before I had to submit the project to HUD or the report to HUD.
Are there any other questions or comments on this? Okay, let's go ahead and move on. Section 7.1, grant selection working group. Dory?
Yeah. I actually have this attached to one of the agendas, so it's in your packet. Just so for people to look at it. We're going to be talking with the executive committee about this next. So we do have $400,000 that is going to be going towards prevention and diversion. We're working on the RFP. We're going to finalize the structure of the RFP with the executive committee later today. Half of it we're hoping to use for prevention, so $200,000 for prevention, $200,000 for diversion. We are really going to kind of stress in the RFP. We're hoping that the diversion activities that programs could come up with would be a collaboration with court mediators on people that are going through eviction. We need to start that collaboration with court mediators. Our COC has not yet. And so we're trying to use this money to open up a door that we can start helping some families that are in mediation, because then there's money in the justice system to go to diversion. And if an agency starts this project, they'll have, the county will have that. We have a program, and so that helps get more money as well. And so there's ideas there, and so just for people that know. And then all prevention monies can be used for rental arrears, rental application fees, security deposits, advance payment of last month's rent, utility deposits, and all that. And so after we talk with the executive committee today and kind of get the framework, we'll be writing up the questions. The grant working group meets the third Tuesday of every month, and we'll be going through the timeline. And so if anyone's interested in helping score, please come to that meeting, because we're the timeline. So if you're available, the interviews do take a full day, and so we do need people that can step away from their jobs for a good, 4 hours, 5 hours sometimes. So just so that people know that everything's on Good Grants, it's easy to score, and then we take it from there and do the interviews. So if anyone's interested in learning the process, join us, because we're going to give this one some extra time, because people will be going on vacations during the summer. So we'll probably post it and give it a good 2 months that people can work on their grant application. And so it'll make it easier for everybody if we don't do it through the summer when, people are working, and we've already had a discussion with some of the scoring teams. Some of them will be absent. So, yeah, if anyone's interested, and there's more information on it, again, it's attached to your agenda. And that's it. That's pretty much the only thing we're working on. We will be working on a youth little outreach project thing too, come around school time. I think it's been $15,000, not much. So, so we'll be talking about that at our meeting.
If I can ask, I know that behavioral health and social services has programs to help with rental assistance or things like that. If any other agencies, and including behavioral health, social services, have those types of programs, if you can email the title of the program and some brief summary of the program, so that we can get a pamphlet out to our public defenders right away, so that if they go, one of their clients goes into mediation for eviction, we can hand that paperwork out. I haven't followed up on that, and I apologize, but I wanted to make sure and follow up today and see if we can get that information. Because we're not looking to duplicate anything that already exists. We want to fill in the gaps that it still exists. Please, thank you. Thank you for that update. Any questions or comments?
I have one comment that through our programs, we've noticed that when you get to a point where somebody's being evicted, a lot of times the landlord or the renter is not willing to solve that issue. They would rather part ways.
And that's understood, and hopefully mediation can find ways to solve some of those things. If it's for any reason outside of I can't afford it, I don't know that we can help if you're trashing the place or breaking other contractual agreements. That I don't know that we can help with that. But if it's I lost my job or some emergency occurred where now it's getting really difficult for me to pay rent for a month or two. We can't keep paying forever, but we could definitely help so that they don't end up in the streets and coldly making it cost that much more for us to take care of them and help them.
Well, the evictions process requires them to go to mediation. So I personally work with like Liz at Lake County Mediation. But so you get her kind of on your side and she's in the courts. So
the majority of them do at least entertain mediation. I don't know if they 100% go through that. Because they would prefer that they find a way to resolve it, whether it's still I'm leaving, but we didn't have to have the judge tell me I needed to leave, or things like that. But I think the majority of them are offered mediation as they go through that process, based on the conversation we had with the public defender. We just want to make sure they have all the information so they're not blind.
yeah, there's resources available if they just don't know about.
Housing Navigators Working Group, Caitlin was not here earlier. I don't know if she's shown up. I don't see her. But we did talk about seeing if we can break up that group into housing navigation and casework or case conferencing.
Christina can.
Oh, Christina. So sorry.
That's okay. Can you repeat the question? Oh, sorry. Can you repeat the question?
Getting a working group update. Housing Navigator was up. I mentioned about the splitting it into Housing Navigator and case conferencing, but if you had any other updates for us.
We just have tried out a new agenda format. We got some feedback from folks and we shortened the agenda overall and rearranged it. So it's been going really well. We've been getting a little bit more engagement, but I'll take back your idea to the group and give you an update on that as well. I'll copy you on the emails as well.
Appreciate the work that's being done to get the landlord list. There's a lot of work that's happening right now in that group with that. So thank you very much.
Mm-hmm.
Lived Experience Working Group, Dustin?
All right. Hello, everyone. So update, we finally have stuck to a permanent date for the meetings, which is going to be the second Thursday at 3:30. We have come to the conclusion of having 11 max 11 people for the voting members. We currently have 7 positions filled. 3 of them are attending college, so they're not attending meetings regularly until after May 19th. We met with CES and provided insight on the youth vulnerability assessment. And this is kind of how the lived experience advisory board is going to be contributing to the COC. And the members that are currently here have put together bios to put onto the COC website. And I was wondering, would this be appropriate time for them to read their bios?
Let's do it. Did you freeze or?
All right. So I'll start. We wrote them in third person as for the website, so just keep that in mind. Dustin Lawson is more than a leader. He is a survivor, a change maker, and a fierce advocate for those who are too often unheard. As executive chair member of the Lake County COC and chair member of the Lived Experience Advisory Board, Dustin brings wisdom born from lived experience. He grew up navigating unstable housing, incarceration, and addiction, and understands in his bones what it means to live without safety, support, or a place to belong. For Dustin, this work is deeply personal. He lost his brother on the streets of San Francisco, an unbearable tragedy that became a turning point in his life. It taught him that housing isn't just about shelter, it's about dignity, healing, and survival. He knows firsthand that most families are only 1 or 2 missed paychecks away from becoming homeless, and is committing to building a system that never forgets the truth. Today, Dustin is a college graduate with degrees in human services, chemical dependency counseling, and social behavioral sciences. He works as a community health worker and is the founder of the Recovery Scholars Club, a student-led movement that uplifts people in recovery and dismantles stigma that so often holds them back. Dustin serves on the Lake County Lead to be a voice for those still struggling in silence, those in jail cells, in recovery, in shelters, or just trying to hold it all together. His heart beats for real justice, recovery, and second chances. His focus areas include reentry support, mental health access, substance use recovery, and creating spaces where healing and community can thrive. And now I will pass it on to our next member, Maria.
Amazing, thank you.
Hi. So Maria is just freshly starting to begin what she believes is her soul's purpose in life. Most of her adult life, she has battled addiction, housing instability, and homelessness. While in the midst of her addiction, she realized she was being called to become an advocate for herself and others in shoes like hers. Now, with the resources of the Transitional Housing Project, the Hope Center, she is looking to start a certificate training program to become a peer support specialist. Maria hopes to be an inspiration to other community members as well as having an impact on changing how addicts and the homeless are viewed and treated by law enforcement and the community. Most importantly, Maria's goal is to turn her negative life experiences into a blessing by enabling her to help others. Thank you.
Thank you, Maria.
Okay, now Tim, after spending half of his life behind bars, Tim emerged from prison with nothing but determination. Experiencing homelessness and previous addictions, he rose above and entered numerous NA programs and was also accepted into Hope Center, a housing navigating program that focuses to help individuals experiencing homelessness, achieving substantial housing despite experiencing these setbacks. Tim tackled every challenge head on. Tim secured income through SSI, obtained his driver's license, and even saved enough to buy a rolling new car or vehicle. Tim is no longer defined by his past and devotes his time to helping others who are experiencing homelessness. Accomplishing these goals is a symbol of my newfound freedom, and by being a shining example, Tim is living proof that it is never too late to start, spread, and inspire others.
Thank you, Tim.
George has been a Lake County community member for 48 years. George attended Lower Lake High School and played on a football team. One of the things that George is most proud of from his youth is at Lower Lake High School winning 2 championships when he played football. Growing up, George wanted to be a Navy SEAL and a marine biologist. He was not able to join the Navy due to a seizure disorder and lasted until he was 40 years old. George worked at Konocti Harbor Resort and Spa for 12 years between 96 and 2009. He loved his job there and has worked with many famous artists, including Sammy Hagar and Brooks and Dunn. George's experience with homelessness started after his divorce and after his mom passed away 8 years ago. George used methamphetamines to escape and to cope with his pain. On July 7, 2024, it was the last day that George used substances. On July 8, 2024, George called son Tina Allen. George said that after talking to her, he trusted her, and that is saying a lot because he didn't trust anyone, especially women. Tina motivated George to go to the hospital, and she promised him that he would be treated like a person. She kept her word, and his experience changed his life. George describes his first meeting with Dr. Robbie as an intervention. George had a heart infraction test and asked Dr. Robbie how bad it was. George's heart was working at only 10 to 15%. Dr. Robbie was straightforward and told George that he is a smart man, and if he leaves the hospital and continues to use drugs, he will be dead within a year. This had a huge impact on George and demonstrates the importance and impact of having a son like Tina Allen, providers like Dr. Robbie that deliver difficult information with compassion and treat people with dignity. George was very sick. He was on oxygen and had cellulitis and abscess on both of his legs. On day 6, Tina visited George. She had checked in daily, but George was always sleeping. On the 6th day, George was awake, and Tina asked him what his plans were when he leaves there. George said he needs a tent because he didn't want to go back to the place he was living in because he wouldn't be able to abstain from using and living in a house with drugs. Tina asked him to stay for a couple more days while she worked on a safe discharge plan. George became cheerful when he said Tina came back and said he was going to the Hope Center. George says he was filled with hope that he can continue his recovery and work on reuniting with his daughter. George is now reunited with his daughter and is working on healing their relationship. They text daily, and he is looking forward to meeting his grandkids. George says, "This has all come back to me because of my sobriety. I am a healthier man at heart because of sobriety. I put my sobriety first and attend 5 meetings a week. I brought NA back to the Hope Center as a gift to Carissa. What a better place to attend a meeting than the Hope Center. Hope Center has given me so much. Staff, the people are amazing. Tina, Denise, Carissa, Ronnie are my role models. I think of them as disciples." George is now a trusted volunteer at the Hope Center, and his gratitude shows with all the ways he finds to contribute to the community. George is a student of Woodland Community College and the culinary program, and is hopeful for an internship at Canocta Harbor. George describes this as full circle, as going back to Canocta Harbor will be like going home. George thanks Adventist Health from the bottom of his heart that he is now healthier. He expresses gratitude and partnership for finding his services that provides his recovery. George shared, "I was so close to death." George is grateful for Chef David Barboza, who lets him utilize the kitchen and get practice for exams. George earns good grades and is very proud of his grades. George's story is a beautiful example of the impact of continuum of care that we provide, and is living a life full of health, wholeness, and hope.
I believe that's everybody in the room.
Yes, it is.
You just filled everybody's hearts today. I think that was awesome to listen to. I'm glad that you offered to read those out loud. Thank you so much.
You're welcome. And that sums up our update.
Love it.
Love it. Can I make a request?
Yes.
Would it be okay to get pictures of each of you to put above your bios? And then I can add that, create a page for the Lived Experience Advisory Board on the COC website?
Awesome. Yeah, that sounds good.
All right, thank you.
Thank you.
I really had a lot of fun with them when I met with them, and they're really outstanding people. So.
No, I love it. And Dustin, great job for putting this crew together. Looking forward to what you guys are able to do. I know that I had Carissa and Dustin in my conversations this past week about the encampment resolution, and I'm sure hoping that conversation goes to the lived experience group so I can really get that feedback from them as well.
Yes, we look forward to that. And anybody else that would like us to contribute to anything, let us know, and we will put it on our agenda for the next meeting.
Thank you. Thank you very, very much. Next is Zoning Regulations Working Group, Angelique Cole. We will follow up with a meeting with you and Melissa, and I apologize for that. Nothing has happened quite yet. All right. Shelter updates at Hope Center. I have here that.
There was a 7.5.
Oh God, yes, yes, yes. Thank you. This is why I have awesome people around me. This is the Encampment Resolution Fund, the working group. I've met multiple times with the different folks within the group because we're not able to find like a specific date of when to meet. But I wanted to make sure and hear everyone's thoughts. We originally started with the idea of looking into two things, safe parking and tiny homes. With $1.5 million, we're never going to be able to do tiny homes. Everyone that I've seen from Sonoma County down south to San Diego, they've spent at least 1.5 to 1.7. So that doesn't leave any meat on the bone for management of the village. So we're not throwing away the idea, but we are moving forward with Plan B for the tiny homes, which is to work with a different group to find us a grant so that we can start to continue moving forward with the tiny home idea. It's a necessary part of the continuum of housing. What we're kind of settling on in the Encampment Resolution Fund is looking at safe parking spaces. And we're having conversations with the city of Clear Lake. We're having the conversation with the city of Lakeport. And there's always the opportunity of maybe utilizing the parking lot and maybe some of the space that's available in Hamilton Haven at the current shelter that we have in North Lakeport. So we're looking at those options. We're looking at the cost of what's it going to take to have porta potties there. How can we organize showers there? Who's going to manage the area to keep it clean? What does garbage look like? We're just trying to figure out how we're going to budget the 1.5. The grant is through 2029. So we're going to try to make that last for the 4 years. And just as a comparison, it's not a really good comparison, but at least it gives us an idea. We're spending about $60,000 a month at Hamilton Haven to run a 35-bed facility. If that was $60,000 a month, it would take $1.4 million for 2 years. It's not going to be $60,000 a month to run a safe parking area. So we don't anticipate having any problems to last 4 years. And maybe we can do more than one safe parking area, which would be great. And the idea for safe parking area, especially in our conversations with, actually all of the conversations kind of said the same thing. It's kind of a missing component between being on the streets and getting people in a shelter, where they don't want to trust being under the rules and regulations of a shelter. They don't trust anybody that has said in the past, we're going to help you, but they're not. There's just different reasons as to why there's lack of trust, but that a safe parking kind of lets them come onto a safe parking area through their own means, and not necessarily stripping them of what they own or what they have. And so it might be a way to build trust, still provide services, and also maybe be that segue towards getting a yes answer to the types of services or sheltering that they need. So that's kind of where we're at this moment in time. Anybody else want to add to that?
Dreamy, really nice. It's like gap coverage there because that's what people are falling in the cracks.
Yeah, and our goal is to create all levels of continuum of housing. I'm really glad LCCoC is here for transitional housing. We need more transitional housing. How can we get more LCCoCs, or how can we get more houses under her purview to grow that? How do we get tiny homes so that people can get out of the shelters into something that's manageable, but not a full house? How can we get the safe parking? Like, all of those things are ways to move people through the process and also catch them at the level that they're at and not have to start at the very, very bottom level each time somebody goes through eviction or whatever the case might be that puts them into unsheltered status. And so we're working on all those things, and it's slow, but it's coming along.
Spectrum support.
Yeah. Any questions or comments regarding that? Did I miss anything? No.
SWIM has transitional housing, so I'll get in touch with the Housing Navigation Committee and meetings will start getting involved with that.
Yeah, and if you can also send an update to Melissa, we need you to be a member.
We will be.
I know you will. I know you will.
That's first on my list.
But if what we like to do, and this is coming up next, yes, is what's happening at each of our housing stations, I guess. Like how many beds are open, what's available, so that we have an idea of what we can do and bring people to you so that we can get those beds filled up. So Hope Center, now that I didn't skip anything, Hope Center housed 2 people in April. They had 1 female bed open. I don't know if that is still the case. Do you have an update on that, Carissa?
I can jump in. It looks like she's gone. We are full.
Okay, and I think that's what Dustin was going to probably say. So Hope Center is full and housed 2 people. Then we have the Nest. The Nest had 1 room. Is that still the case? Yes. So that they have 1 room currently available with a maximum of 2 parents and 2 children ages 0 to 2. They have 3 families that were housed last month, with 2 families moving in within the next 2 weeks, and currently exploring needed support from COC. Got my interest. Okay, we'll have that conversation then. Project Restoration, they had 1 female bed open. Is that still the case, Ronnie?
Yes, and I believe we might have a male bed at this point as well. I'll double check though.
As on my summary, female bed and 1 male bed. No one was housed and do not need any support at this moment in time.
Yes.
Okay, thank you. Then we have no update from Scotts Valley. Is that correct, Melissa? At this moment in time, we're still waiting for them to be all permitted and ready to go.
My understanding, yeah, I didn't receive any information back from Scotts Valley, so I'm assuming that it's still the same as it's been.
I'll email Summer and see if I can get an update just to see where they're at.
Yeah, well, we had our inaugural board meeting yesterday.
Oh, nice. That's right. They were asking for board members.
Yes, I'm vice chair.
Congratulations.
Thank you. So yes, there's still a little work to do on the 2 homes.
Okay.
The 13 staff members will do a training soon, and after the homes are ready, licensing is the next step.
That's exciting. Thank you. Next, 8.5, supporting bright futures. Women's house with 4 beds is full. Men's house with 10 beds has 2 open beds. Is that still the case, Angelique?
My women's house has 1 bed open, and correct on my men's house, there's 2 beds open.
Do you guys, all of you with the open beds, and Ronnie, I feel like I'm just talking to the same person here. Do you check in with Heather to see what's on the hub of who's available, who's looking for?
Yeah, it's pretty rare that we have open beds. So Heather is a squeaky wheel, believe me. She is filling them.
And Angelique, do you communicate with Heather to see what
I
might be?
communicate with Heather, and Hope Center and I work a lot together back and forth. And so, yeah, I don't know if all the groups are communicating, but those are kind of the 2, besides probation, because they send me people all the time. But those are kind of the 3 that I work with regularly.
Just want to make sure if you have beds, I want to fill them.
Yeah, I have men's beds too, and I've had them. I've never been full in my men's house. And now the women's house has 1 bed, but that's rare.
Ronnie?
And just for clarity, we ask that most referrals go through, unless they're walking into Hope Center or something, that are going through Heather. So she's screening them and getting them to the appropriate spot. So if you want somebody at Restoration House, send it to Heather Frawley, and then she'll contact us.
She's our filter.
Yes.
All right. Next, Homerton Haven, 4 beds, 2 top bunks in the women's side. I take it that means that there's 4 beds open, and then 2 top bunks on the men's side as well. Is that correct, Melissa, the way that I'm reading it?
Yeah.
Okay. Let's get those beds filled. I don't know if that's changed. Justin, do you know what the status is?
Yes.
Yeah. And let's make sure are you also getting reached out, outreach from Hamilton Haven asking if you have anybody else that they can take?
No, I just refer people
Okay.
directly to them and what the rules are.
If you can check in with them, because if they have 6 beds open, those are beds that should be easily filled. All right, well, I've gone through my entire agenda at this moment in time. Is there any other comments that anybody would like to make before we adjourn this meeting?
I just have a question, Barbara Christwitz. I'm not familiar with Scotts Valley. Give me a description. Who goes to Scotts Valley and where is it?
Scotts Valley Band of Pomo Indians have been working on a few facilities. They have I want to say a sober living environment that's outside of the county that they are running. And then they're also working on 2 facilities in Lake County, but I'll let Carl describe it further if he needs to.
Yeah, what I can remember from yesterday's meeting.
Yes.
Yeah, we had a great meeting, great board. The target is ages 16 to 20, although 15, the license will be 15 to 20. So someone who's just about 16 would be appropriate. So that young adult age.
Okay. So the transitional age youth
Yes.
age.
Yes.
Thank you.
Yes.
So the SLE is generally for people who are native. So I refer,
And they are out of county, the SLE, right?
I'm not sure. I just refer them.
Yeah.
Is it?
That's what I thought. That's what was in my head.
No, so it was for all, not just me.
So the referrals that I'm making to Scotts Valley are all for people who are Native American.
And I'm going to say that based on our PIC counts and the overwhelming proportion of Native Americans that are homeless in comparison to the percentage of the actual population represented in Lake County, keep doing what you're doing because we need to make an impact on that population. That's been a worry and struggle of mine at the COC is we have such a large percentage of Native Americans that are homeless, but such a small percentage that are being serviced to try and get into a better position. And so I think that's the opportunities we're looking for.
If I get a referral and I happen to know what their background is, and it turns out that they are Native American, I do refer to them first.
Good. I see a hand from Meredith. We talked about you earlier.
Yes, you do. And I just want to say that this is my last meeting. I mean, even though unfortunately I'm not there, I do really, really, really appreciate this group and the work that this group has done over the years. I was part of the initial ones, but I can't remember how long that is. Amazing, amazing work and amazing progress.
Absolutely. I say this from the bottom of my heart, Meredith. Good day, mate.
Thank you. And I just want to highlight really quick the shared stories from the bios is what keeps, I mean, that's what we're all here for. And that's at the end of the day, that's it. I mean, it's just amazing work and you guys are wonderful. Thank you.
Appreciate you joining us today. We're all sad you're leaving, but best of luck in your next adventure.
Thank you.
I see no further hands up and no one yelling in the room. And so this meeting is adjourned. We'll go ahead and take a 5-minute break, walk around, get some air, and then we'll go ahead and do our executive committee meeting. Thank you, everybody.
Well,
Thanks for joining us, Ben. Thanks for coming.
So Brenda, you'll be happy to know that as I and I'm sorting it by office and
Say that last part of it.
the number of people that are actually housed.
Good.
There's like 357 people on this one working on the site. I'm dividing it and conquering it a couple different ways.
Well, see, I haven't pushed for something that would make your life possibly miserable. And that's to get social services to enter their data into HMIS. I know they don't, and it's a lot of data. And I don't want to ask what's the cost, right? It costs money to spend time and enter data, duplication of data. But at one point, I would love to have that, which would make your numbers double, if not triple. Last I heard, their numbers were like 1,200. Your name, sir? My name is Stephen. Very nice to meet you. There's a lot of feelings. People who care. Thank you, sir. You came on the right page of your report. You as well. Yeah, I'm happy to hear you have elders during that 1 hour. I heard it.
I didn't realize they weren't originally entering it, just because I don't do any of that. I just assumed that it was, but I was surprised when I found out, and I'm glad that it's being entered now. Yeah, that's
It doesn't make sense not to do it, but at the same time, it requires capacity, it requires time, it requires a person, and it's not always that simple.
I just dream of entering accountability. I
just dream that I can think of something and it happens. We're getting there. We're getting there.
Basically, it's as far-fetched as the dream that I'm dreaming of, so.
Technology will let it happen eventually. It might, be a little awkward, but I'll take the awkward.
Thank you so much. I appreciate you guys letting me drop in.
Drop in anytime.
I'm gonna get registered. Don't you worry. Thank you.
Did you guys open up in Clear Lake?
Yes.
And are you across the street from Tribal Health?
Yes.
You took over the dispensary?
No, it's actually a block up from there.
You're up further where the water is.
Yeah, across from the post office.
Gotcha. I always thought you were taking over the dispensary. I don't know why.
I did not like.
Big close.
So much. It's nice to meet you. Yeah, it's so cool. There's a lot going on, so can't wait to.
I saw your big bus.
Isn't that fun? We get to drive that to Tribal Health tomorrow to the event. Are you guys going to the MMIP? I know I see your little, yeah.
Oh, yeah.
Yeah, I was like, cool, it's gonna be fun. You'll see us all there. My CEO and my boss is gonna be there and stuff. So I'm like, hi.
Awesome, absolutely.
And I'm Deb. Thank you for having us.
Very nice to meet you. Looking forward to more.
Thank you. Heather, you're amazing.
I have a few cards.
Oh, yeah. Thank you. I need to go ask you for some pamphlets too.
Yeah, I don't have any.
Business Health does not cut their budget on business cards.
Oh, good to see you. Okay. Oh, did you see the date?
I have to, so I'm training probation on the 23rd.
Exactly.
I have a few others, so.
Yeah, so I'll come back for the
Okay, let me know. We'll like the pizza.
So.
All right, sounds good. Okay, bye. Bye, good to see you. She's a great girl. Bye. Bye. Bye.
All right, is everybody ready?
Yes.
Let's call this executive meeting to order and let's do roll call. Melissa, please. She disappeared. Getting coffee.
You called for a break.
Oh, sorry, I was texting one of my children real quick to get home and do their chore. So, anyway.
That's fun stuff right there.
Supervisor Sabatier.
I am here in person.
Doreen Gilmore. Dustin Lawson. Heather Frawley.
Present in person.
James Murdoch is still absent. Shannon Kimball is absent. Anna Santana. Brad Rasmussen.
Here.
Rachel Parsons.
In person.
Melissa Kopp, I'm on Zoom. Scott Abbott. Is Scott still in there?
He's here.
He's quiet.
Okay, we have a quorum.
Thank you very much, everybody, for being here. Approval of April 3rd, 2025 meeting minutes.
I'll make a motion to approve if no one has any corrections.
I do have a brief question. Are we doing the March and April meeting minutes? And should we have identified that in our previous one? Because our motion last time was to approve the April meeting minutes, not the April and March. And so at least take care of it for us if we can approve March and April.
I thought that during last month, we had made the change to switch out the name for agenda with meeting minutes, and that change would end up as an approval for the minutes.
Oh, it was. I just see that it's in the document. It's just in the document to show that the changes were made. That's it.
Yes.
Okay, never mind. Sorry. Don't listen to me. So we have a motion from Heather.
A second.
And a second from Anna, and we're gonna have to do a roll call on this one, please.
Okay, Supervisor Sabatier.
Aye.
Doreen Gilmore.
Aye.
Dustin Lawson.
Aye.
Heather Frawley.
Aye.
Anna Santana. I'm
She
assuming
said
that's an, okay.
He says, aye.
Brad Rasmussen.
Aye.
Rachel Parsons.
Aye.
Motion passes.
All right, we want to make sure you hear us. There will be no conflict of interest based on all of the items that is on here, but just in case in the future, step outside if it's regarding your agency contract and funding. Any public comments regarding the COC or the executive team for something that's not on the agenda? I see none. We're going to move on to monthly financial review.
Okay. I'm gonna share my screen. Where can I put my glasses on?
Yeah, because you got small print on that stuff.
Yes, I do.
That's what happens when you have so many numbers.
Numbers are awesome. They're very predictable. No two comes before.
Oh man, here I go.
Yeah, this is. I got putting up on the screen. Yeah, the screen pretty well there.
Talk us through it.
There's not a lot to talk through. This is the most updated version.
Okay.
I've added the county resolution grant on there. Just have it under, planning and miscellaneous right now, but we really haven't determined the full expenses yet.
Yeah. Do we have all the old grants? Are those closed out entirely, or are there like dollars left?
Everything up there is not all closed down.
I'm looking at the CARES, ESG.
Yeah, these lower ones are what we have.
There we go.
In those particular grants.
And so we have a total currently of 1.9. No, that's not the total at the bottom. You got to scroll down a little bit more. We have a current total of 4.7 million with 2.7 million of that allocated. Is that correct, the way I'm reading it?
1.26 million is unallocated of that remaining. It's not spent.
Okay.
Does that make sense?
No.
Okay.
Because 1.5 of that is completely unspent. Because the 1.5 doesn't show up above. You don't have a total.
The above, the 2.7, 2.8 is what has been spent. The bottom is what has not been spent. But of that, 1.1 is unallocated.
Some of it's allocated, it just hasn't been spent yet. So
Well,
it's
but
available.
I don't see the 1.5 million in there because you don't have a total. That box up above is blank. Shouldn't that be where the ERF is? So I think we have 1.5 more.
Yeah, you're right.
Somewhere in there.
Sorry.
So it should be like 6.2 and 3.2, no, 4.2, and then $2.6 million unallocated at this moment in time.
You are correct.
Okay. That's great, as long as it doesn't go the opposite direction.
I have a question. Have we ever approached Hamilton Haven yet about some of their unspent funds for maybe year 3?
You know, what we're doing, it's a good thing you brought that up. We're in the process of obtaining an expenditure report from them. I think I mentioned last time that their invoices have been kind of
low.
They were not just low, but also undefined. You know, let's say things like this much for staff wages, this much for, but you know, so we've asked for an expenditure report that reflects the contract. You know, the different components. You know, how much have you spent in this area of the contract? And so we're waiting on that because I think I mentioned also they sent us. They said they forgot to bill us for indirect costs. And so we got a bill for $110,000 or something like that. And so I asked, well, what's in your indirect costs? You know, what do you call indirect costs? And so they're going to get back to us. They're in the midst of doing 2 audits themselves. However, we are also not paying them until we get that expenditure report, and they know that.
Good. And hopefully you get that information before May 28th, where we do their performance review.
Exactly. And then Melissa and I were talking about that. She's preparing just for that and had those very questions.
Yeah. Okay.
So when we get that information, then we can discuss maybe utilizing some of their unspent funds for other things.
Right.
All right. Because, yeah.
Thank you for bringing that up.
Well, yeah, I just wanted to make sure we were starting on all that because, you know, we need to keep our CES going. We need, and then Rachel brought up something, you know, I think, was it the Section 8 vouchers? We need to match something or something to keep people going, just even for longer on.
I mean, I can talk about that if you want, but the bottom line is we won't know until federal fiscal year begins. So we're just kind of waiting to see. But they've proposed cutting the half down to 87%, which would mean essentially removing 21 families from the program. If I give it to RHA by then, they have other funding streams and would not have the same. Okay. I will bring that to you when the time comes.
Okay. Just before September. before the budget shuts down.
When I know, like, sometimes they don't even tell us until after it's effective, which is really super helpful.
Yeah.
It takes a while to go through those 2,000 pages that no one else has read. All right.
So to kind of go back to what was about coordinated entry, we are putting together a contract for that. You might remember the previous contract actually expired. And so we just can't extend that contract, so we have to do a new one. And we put one together, and Adventus is currently reviewing that.
Because we had HUD funding, but yeah, we need to, yeah.
This
Is that
is-
one
this-
of the HUD competition monies or
They're-
planning monies?
This is for, yeah, so include part of that.
Is that up there too? Are we putting our HUD competitions and things?
Are we putting our what?
Is that up here on this? Your list?
Yeah.
Okay.
Is it part of the HUD competition is part of your spreadsheet?
Yes. Oh, yeah. HUD is up here.
Okay.
HUD
I haven't
funding.
noticed it.
Can you send us a copy of this, just so I can play with it and take a look at it?
Yeah, I'll fix them.
I'm interested in understanding, like, how do we spend down the last 50,000 of the 2020 stuff? Like, is that already allocated? And so by looking at it, I'll have a lot more answers. But I'm just looking to see what's available, what's already allocated, and what are we doing if it's not allocated in order to make sure that
We
we're.
don't miss out on any money yet.
I don't want to give away anything, and there's the need out there, and so what can we do to spend that as soon as possible?
Right. I think this, I can say overall, we've been spending regularly. You know, I mean, everything is kind of falling in place. And we're spending timely. You know, the older funding we're spending first. There's still, I think, like a couple things from, for example, HHAP 1, you know, has some, that's pretty much entirely spent except for some planning dollars. But we've talked about using those for coordinated entry, for example.
So it is I can't see it from here, but it's HHAP 5. We got the money for that, correct?
Mm-hmm.
And then we're now doing have they released number 6 yet?
The NOPA's out, and it's due this summer.
August or something like
Yeah.
that.
Okay, and so can we give Linda some ideas then for what we're
Yes.
planning on, what we would like to do with that?
Yes.
And that's going to come back to us first. Does it also go back to the Board of Supervisors, if I remember correctly, on the past HHAPs?
Yeah, I think so. I think they-
Yeah, because it's both continuum of care and behavioral health that
Yes.
receives like a split chunk.
Right, yeah, both, yeah, right, both the
And,
county
yeah,
and
county monies, yeah.
yeah, and so, so we do need to, Linda's looking forward to that. In fact, she was gonna be here today, but I guess she couldn't make it. But she, you know, she does want to, you know, start getting that feedback. I would invite her to come to our grant selection committee. With that. We usually end up talking, you know, more about it there in the preliminary way before we bring it here.
Yeah, because it'd be nice to get that expenditure report so we know we wouldn't have to give them as much and we would be able to plan year 6 with some other, yeah, for the you know, the shelter.
The shelter, yeah.
Okay.
So,
Put some more.
it was brought up earlier, the transparency, we talked about it in previous meetings about posting not specifically this, but something that exposes this information. We get emails from Cal Matters that asks us because they want to write up how the whole state is utilizing these dollars and why it's not making an impact on homeless, or if it is making an impact. I was just at a meeting in Sacramento where Cal Matters kind of led the conversation about their findings and things like that. It's actually a lot kinder than I thought it would be. It was kind of weird. But we get a lot of requests. And so the more we can be transparent and putting it on our website, the more we can lead people, say, hey, you wanted this information? We're posting everything. So I know you're working on it. It's something that's on your list. What's the status of getting that accomplished?
Melissa and I are, you know, we have that as made that one of our priorities. I want to do that. I actually would like to get this spreadsheet on the website.
I'm fine with the spreadsheet. I think if there's ways to explain it more.
I want to make, well, that's the thing, right now, I mean, it's kind of a technical issue because we can put PDFs on the website. But this is an Excel spreadsheet. And, what I like about this is, I can go and, to a certain thing and I can get more detail of what's going on in that box, in that cell. And I want to have that for the website too, so people can see where that money is being spent or what it's allocated for, or, but part of it has to go to youth, things like that. So, that's the big goal, is to try and get the spreadsheet, not just, a PDF with a bunch of numbers on it.
I can give a brief update on that. The spreadsheet is not going to work on the COC website. I have tried to upload it, and the app that accepts spreadsheets, uploaded spreadsheets, is rejecting it. The only way I can get the information on there as far as like a spreadsheet goes is to manually enter every single cell into the COC website. So I think we need to come up with a different game plan on how we're going to get this information on the COC website. I haven't been able to address it or tackle it because of all the reporting that's been happening with HMIS.
I think I might have an idea, and then Christina also is raising her hand kind of in the same. Let's hear what Christina has to say.
Oh, I don't know what your idea is, but I was just going to ask if you could take like an image, kind of a snapshot. There are two things I think you might be able to do. One is convert some of that data into, images and charts that better tell the story. Sorry for the background noise. And then perhaps take an image of that and have it dated. So, and post the image on the website.
Yeah, I can absolutely do that, but to get it to where, with what Scott's talking about, to have the ability to interact with the spreadsheet, so we can like he has right there over the $180,000, just hovering over it, it says Scott Abbott, Homerton Haven, 18,000 and some change.
Right.
In order to have that interaction, it wouldn't be there, and so that's what Scott's referring to, is having that possible on the website. And I mean, like,
I'm just suggesting a workaround until maybe that's supported.
So I think because you guys probably have Office 365, when you try to upload something that lives in your, that isn't on your desktop, it can cause issues with saving. So if you save as and just save a copy on your computer and then try to upload it, and then make sure you lock all the cells so that people can't enter or change data, but they can kind of put their cursor over the little red arrows that give the message.
And I think that you guys know what we're looking for. Yeah. I think that we're all on the same page for what we're looking for. Let us know how it's going, keep working on it. If you need to use me, I used to make websites. I'm happy to help out in order to make it as easy and intuitive for people to find this information. I know you have already a lot of on your plate, so please use me if you want to. But I think that I don't want to get into the weeds too much. I think they know what you guys know what we're looking for. Yeah. You know what you're looking for, and so let's just keep getting a status update.
There's definitely some goals that we have, for our website. This sheet is one of them. Another one is having ongoing performance review measures on there.
Yeah, absolutely.
So that.
And that's why our performance reviews need to be signed by the chair and by the agency that was reviewed. Like, yes, these are our findings. We have reviewed this time frame. Everything looks great, or we've reviewed it. Here are the findings of these issues. So on and so forth. That should be on there. The original grant that we submitted to get the funding maybe could be also attached to that. That way you can see how it started, what we did, how it was reviewed. I just think that the more we can create that level of transparency, the easier it is to answer questions, and I think the people will appreciate
I
it.
think we really want to, I mean, like even the system performance measures that, also breaks your neck getting done. We can have like that on our website too, I mean, it's on the HUD website, but it's not easy for people to go through the HUD website to get it, I'd like to have that information, that shows our community is putting this many people in housing, the funding is going, the system performance measure kind of has a lot of the end result of what our efforts, it summarizes our efforts. I'd really like to have that on our website so people can see that this is a worthwhile endeavor of what we're doing.
So if there's funding, I would love to get some help with putting in so we have the licenses and the 5 years covered, but there's an additional expense for the closed loop referral piece. But part of the closed loop referral piece also allows agencies to manage their own sites on healthbridge.care. So healthbridge.care, all the community-based organizations could have their information out in public forum. So I don't know, they were recently doing an update, and so she didn't have those numbers for me yet, but I'm trying to get the cost. What is it called? It's called the closed loop referral, and it's healthbridge.care.
It's one of our 2 softwares that utilize in addition to HMIS.
So when someone opens up, let's say somebody opens up a social service referral and somebody needs partnership. If partnership or the county was involved with our system, automatically the referral could go to somebody's email or several people's emails. Referrals there. It lets you know, hey, the referral's here, they've accepted it. And then as they're working through it, it puts notifications and updates in the chart. Same with behavioral health.
That's why I want to kind of look over those numbers, what's remaining, what's still available. And I appreciate that you give it to us, but I don't want to go one by one here in this room with everybody. But if you could send that to us, and I think that to me, that sounds like a proposal of sort that I would anticipate Adventist Health to submit and say, this is something we feel we need in order to enhance the services that we're doing through the hub. And then just asking us to take a look at it.
I'll make the proposal as soon as I get the dollar.
I'd like to talk to you further with Melissa about your idea of being able to get this, maybe the work. It sounds like you had some experience with this.
Okay, are we done with the monthly financial review? Thank you, and just want to remind everybody, a year ago, we had no monthly financial review, so really appreciate the fact that that is happening now and that we have an organized way of seeing how we're receiving money and how we're utilizing those funds, so greatly appreciated. Next is Doreen's item of the, what she talked about earlier from the grant selection working group recommendation.
Right. So the grant working group, because we want to put the RFP out, so the next time you see anything, it'll be an announcement from Melissa. We just want to make sure everyone's okay with this. The 400,000, 100 is from HAP 3, 300,000 is from the HHIP. And so everyone agreed it should be one RFP. We're not going to have 2 separate RFPs. That we're going to request that whoever takes on this, there will be questions about on the application specific to prevention and diversion. So we want to make sure that they're at least thinking about, putting in a diversion program. And then it was all the county ones that you provided just through referral processes so that at least they get information on where to go. Part of that loop, they'll be accepting referrals, the mediator, but not maybe working with them more closely. And have a list of places for people to go that are going through eviction and an agency. That we provide similar information often going to all mediators so that we're So not only people coming through the door, they're saying they're getting evicted, we give them a handout, but then we're also giving all this information to mediators as well. There was a lot about outreach, but I don't think we could afford to really pay for a lot of radio or anything like that, but at least have flyers and stuff printed up. And then the application would work directly with the public defender court mediators, building referral system, networking, using allocated funds available to aid a specific number of families to see how good a test project might work. It would just create a stronger mediation diversion program, and then look for more funds through the court system maybe. And then half of it would go to all the other stuff. So we're just wanting, that whoever takes us on, that at least attempt a diversion project in their application. That's what we're gonna put the RFP out as. So we just wanna make sure everyone's good with that.
I am good with it.
I mean, we don't have to just everything's been voted on so many times, but we just wanted to make sure everybody was aware of how we're gonna put it out there. It'll be out there probably in July.
All right. Do we have a motion to approve?
I make a motion to approve.
We have a motion from Heather.
Second.
And a second from Anna. Let's do a roll call real quick.
I lost my minutes.
Aye.
Bruno, Doreen. Heather.
Aye.
Dustin.
Aye.
Anna. Did she say aye?
Aye.
Yes.
Wow, she's just in.
Brad.
Aye.
Rachel. Aye. Motion passes.
Did we miss Dustin or did I miss Dustin?
You missed Dustin.
So real quick, Mary Wilson is here, and we had changed our bylaws so that we can flex our executive committee team when like city or tribal leaders wanted to be a part of the executive team. Right now, Mary is not a voting member. I don't know if it's official through the city council yet. But my guess is if it is official, it would be Mary, and if it's not official, it would still be Mary in the long run that they would choose to appoint to the COC through the city council. Mary, is there anything official yet for that, if you're still there?
I am here and I guess I should ask the mayor tonight.
He needs to make that appointment if it doesn't exist. I don't remember seeing it, so it needs to be changed. But Mary is a member, and Mary is a council member representing the city of Clear Lake. I don't know if we need to simultaneously wait for the city to appoint somebody, but I would like to at least start the process on our bylaws to add a new member for the city of Clear Lake so that we're ready to take her on when she's been appointed by the city. So if we can bring that next month, that would be great.
We would just, we didn't nominate yet. So when she finds out from the city, then we'll nominate. And
There's gonna be a
we can
process.
vote. Yeah.
But we can't nominate if we don't have the position available, right?
Are we gonna
We
meet in
allowed
July
for
or
up
are
to
we gonna
two
have it all?
more.
I don't know.
I think it was two more.
I think
What's the
the
date?
bylaw update allowed for at least two additional,
It's probably close to the 4th.
as I recall.
We'll
You-
go back over all this.
Was your intent to add somebody from Lakeport? No, or is that Brad?
Well, no, the intent was to open positions for both Clear Lake, Lakeport, and the tribes.
Okay.
So
Do you
for
have
both,
somebody for the tribes that you're considering, Bruno?
I think we do.
At this moment in time, I don't believe that anybody is raising their hands. We do have some in our general committee, but none of those have made the request to move forward. And I think that we probably should be proactive in that, Melissa, rather than waiting for it to organically happen. So I think we should reach out to all the social services for the tribes that have a social services,
They all have a housing department, they all have a housing.
or reach out to the housing.
What about,
Well, they don't all have housing people.
That would be, that would be one that I'll speak freely. I know we're being recorded. There will be certain tribes that it gets a little awkward. Elam is one of them, where there's a huge separation between the membership and the council. And so we're gonna have to figure out as a group, do we pick somebody from the membership of Elam to represent the tribe, or do we go through the council saying we would like to find somebody? So we're gonna have to figure out some things. It's just the politics of it can get a little
let them decide.
well, yes.
Well,
but
I don't know if you want, what, you're gonna let the government decide or the people who live here decide? The government is not located in Lake County. The government is in Vallejo or some other place, so.
we ask the council, which is typically what you would do for any jurisdiction, is you ask the leadership. That would be the norm. I think Elam is not the norm. At least based on my knowledge of what's happened in their area, the disenrollments that have occurred, and the complete separation between the council and the membership. So I think that there will be certain things that we just need to be a little cautious on how we approach it. But we do need to find folks from the tribes that want to represent their tribes and be a part of it.
That'll come because we're gonna need a quorum count. Yeah.
Yeah.
And we have youth as well. So we're
Yes.
still looking to find somebody. Mary, if you know anybody at college age level 18 to 22.
There is someone who Caressa has been working with. She's a youth. She's just been waiting for her college courses to end, which is happening this month. And so hopefully next month she will be coming in and being voted on as a member of the COC, and she's hoping to take that youth position.
I would go with Carissa's recommendation.
Have we modified the governing bylaws to this?
Oh, we're gonna be looking at them for the city council, so we might as well.
The youth representative was added
Okay.
to it.
Was it added already?
We already did that, too.
Yeah.
Want to make sure.
All right, everybody, if there's nothing further, Mary, get yourself appointed.
I'll talk to Russ tonight. Okay, thanks.
I don't think you'll have to twist too many arms.
No, nobody else wants it, so I'm the only one who wants it, so.
Henry, if we're gonna meet in July, because it's July 3rd.
I expect you to be right here, prepared for the meeting. Where you'll have the good fireworks.
Yeah, you probably want to put it on the agenda for next, for
Yeah.
the general and for everybody else.
Yeah.
I'll be
because
worried
we-
about the neighbor's roof catching on fire.
Melissa, if you could please add that to the agenda about canceling our July meeting, so everybody is fully aware. I think that's probably the best thing we should do, rather than force people to be active on the 3rd of July. Quorum not met. All right, everybody, thank you. Meeting adjourned.
Oh, you didn't hear that.
And you're not?
I've never.
Floater.
Because you have to.
Floating holiday.
Yeah, yeah.